Designs for Strong Minds is a program that recognizes the brain is plastic and modifiable at any age. Designs for Strong Minds appreciates that there can be rehabilitation after traumatic brain injury or enhancement.
Designs for Strong Minds works with cognitive processing, information processing, decision making. When you have a lot of information, Donnelly Marcus is a wizard at figuring out, how to teach people to look at all the information and figure out which strategy is best for which scenario. Just like I take visual processing as one giant category and have many subcategories, and the subcategories include external visual processing of what's going on around me and internal visual processing of planning, Donnelly takes thinking and makes it one large category with many different segments. And the tools that she uses are puzzles and thinking games. And the tools that I use are intervening with the way the environment comes in. So I'm using lenses, prisms, and different kinds of filters. What we do at Mind-Eye Institute is work with environmental inputs, sensory inputs. So the easiest way to show this is in one of the books that I had written called Open Your Eyes and Listen. And in your mind, you have a decision-making section, that would be your judge, and that is conscious attention. Then you have the memory section, where the judge says, I want memories of whatever the sensory signals are bringing in, because we're planning. And so you have the memory section, the decision maker, and then you have the motor skills. So Designs for Strong Minds works with this blue area, information processing, and the thinking about what you know, how you organize it. And what we work with at Mind-Eye is changing the input going in through the eyes and the awareness of the auditory, and we're working with this. We're working with, once you've made the decision, how do you control the muscles to aim and focus attention? So we're working with the motor control, and Donnelly is working with the thinking that goes behind it. We work with perception, she works with cognition. And perception is based on environmental inputs, so we're changing the environment by putting the different glasses on.
When I first began doing this work, I felt that my job was to reverse engineer, to find out what the really brilliant people could do and make it available to the rest of us. It's not fair. We should all be able to do this. So if I meet someone and I recognize that their processing style is a little different, the next thing I want to do is to create the opportunity for other people to appreciate and to learn and to include that processing style in their toolbox of problem-solving skills.
Combining the body piece with the mind piece with the perception of the environment piece is a very strong synergistic relationship that most people need. In optometry, we learn the foundation is called where am I? If you don't know where your body is in space through internal receptors, then you're not going to be able to aim and focus very easily or maintain attention. So the body people are necessary first to solidify the reactions. Now we as optometrists can help enhance that by putting glasses on to shift posture through reflex pathways. But the body piece first, then the perceptual piece, and then the cognitive piece. Not all patients need both, although you can always tweak perception and cognition because there's no end in sight to how much your brain can learn. But some patients, they just need to have the environment balanced for them, and other patients need the environment balanced and then more rehearsals. It depends how many new habits they have to do. If we have a patient who comes in because they had a brain injury and their systems were disrupted, and we put glasses on that can plug them back in, and then they're fine. Other patients with brain injury, the systems that were disrupted can't be made back to normal, and even if we help them balance, they still need to make new pathways. The people who need the new pathways, they have to see Donnelly because they have to have some sort of rehearsal of the new pathways. The glasses we put on can build a new pathway, but Donnelly's work rehearses that pathway until it becomes a habit. Some people find Donnelly Marcus first, some people find Mind-Eye first, and other people read the Ghost in My Brain book, and from the Ghost in My Brain they come to both of us. As far as who comes first, it's usually easier to have your perception balanced and then cognition.